So we're delighted that we had such a great response to this event, and Dr. Conrad has reviewed all the questions that were submitted in advance. She's going to be covering a variety of topics tonight in our hour together. If you have more questions or you didn't get a chance to enter questions when you registered, please use the in-meeting chat and we will be monitoring that throughout our hour together. You're not required to have your camera on today. We know that there are some privacy issues with this topic, and some of you might be getting dinner ready in the car line. But if you're comfortable, we'd love to see your face. It makes us feel more connected. Also, please know that we're recording this session, and we'd like to be able to share it with future caregivers. Dr. Conrad is going to mention several online resources tonight, and we'll be sending you an email with all of those tomorrow. So don't bother if, don't worry if you don't get them written down quickly enough. So let me just double check our population. All right. Now it's time to hear from our guest speaker, Dr. Liz Conrad. She is currently an associate professor at Duke University School of Medicine in the Department of Psychiatry and Behavioral Sciences. She shares our passion for children with prenatal exposure, and she works to help find ways for these babies early in life to prevent long-term problems. Her work has been funded by the National Institute of Health since 2011, and she's been featured on National Public Radio. So without further ado, let me introduce you to my friend, Dr. Liz Conrad.
Thank you so much, Lynette. So good to see everybody. I just want to start off by saying I loved all of your questions. They were amazing. Please keep them coming. Like if this meeting just, inspires you to generate more questions or more thoughts or more ideas, I would say definitely email myself. You can email Lynette as well. Because I really hope that this is, the start of something bigger. I know it's the start of something bigger. It's very inspiring that Lynette has organized such a fantastic team of concerned caregivers. And it's just been, really inspiring for me as well, because, a lot of times us as researchers, we're just sort of sitting in our little offices doing our research, and we're not really thinking about the real world impacts of this work sometimes. And so I think for me, it's really important to make sure that we are talking to you all as experts, because I do truly believe that you all are experts. You have your own important lived experiences. I think if you don't take away anything else from the talk today, I think you should take away the fact that we need to hear more from you. We need your input. We need your thoughts. As I'll be talking about today, the research is not perfect. There are still some, really important barriers to our understanding of how best to support kids with prenatal opioid and other substance exposure. And so to that end, like your information, your experiences are as valuable as the data that we collect in our research. So just as a personal background, I am a mother of two boys. I'm trained as a clinical psychologist. So I know a lot of you asked about medications, and I'll do my best to try to answer those, but I'm not a psychiatrist, I'm not an MD. And so I would have to reach out to my colleagues to help you get some of those questions answered. Also, this is not medical advice that's specific to you all. This is just sort of, I'm going to be giving you some more general advice. And if you want to follow up with, specific advice around your family, I would be happy to talk to you about that and give you resources. And so with that, what the great questions that you submitted, I've organized into 3 themes: the prenatal substance exposure sort of 101 type of questions, some sort of other medication or sort of medical supports, and then I'll end with some behavior supports. And as I was coming here today, I was just sort of thinking about, this topic and this session, and I was just thinking about how, most of us, it looks like, are women, and we are caregivers, we're mothers, And here we are, doing this really great work, right, in the evening or later in the afternoon. And I just was thinking about how important it is for us to take care of ourselves, and especially you all, to take care of yourselves. Parenting a child, even if it's the most ideal, well-regulated, perfect, whatever that is, child, is extremely tough. And then you add on prenatal substance exposure and additional stressors, and it can become really, really overwhelming really quickly. And so I know you've probably heard this before, but I just want to remind you again, there's the metaphor of making sure that you put your oxygen mask on before others. And I promise you, you will be a better parent, a better mother, a better caregiver if you do that. This is a whole nother discussion that we could have about how best to take care of ourselves. And I think it's important to have those discussions. So I just wanted to make sure that I mentioned that before we move on to talking about the kiddos and why we're here. So I'm just going to kick it off with the first question about fentanyl exposure. So there was a question, is there enough documented fentanyl exposure data, or is it too recent of a drug? Does the documented level of exposure at birth determine the severity of long-term effects? And this is such a good question. I'm going to be saying that over and over again. This is such a good question. The fentanyl is really recent. And one thing, to take home is that research takes time, and it takes too much time sometimes. I worry about that. There are people in the field trying to speed it up. But there are some hints that fentanyl exposure may be different from other exposures, like exposures to methadone and buprenorphine. And so there was one paper published showing that there might even be a different kind of withdrawal symptom associated with fentanyl exposure. So I just want to say that the research community, the National Institutes of Health, National Institute on Drug Abuse, we're monitoring this. We're concerned about it. We want to do more research on this, but we just don't really know. We don't know at this point, unfortunately, what the effects are. I would say if you do have a child with fentanyl exposure, honestly, reach out to us too, because we could also, collect some data in the meantime and try to get some of these findings out there quickly. So let's keep talking about that. And then in terms of level of, so this is the other sort of confusing thing about the literature in terms of the level of exposure at birth determine the severity of long-term effects. There have not been clear associations showing that kids with more exposure or longer exposure have worse outcomes. And I think this is, probably when I've talked to other experts about this, it seems like this is because there's differences in metabolism. So some moms will metabolize substances different than others. Some babies will metabolize substances different from others. I also think we're really bad at measuring exposure. I mean, probably from your work, that it's just really hard to even, who remembers what they did a few weeks ago? And so it's hard to get, our self-report, and we also don't have the really good, indicators of use. And so I think that's contributing to this as well. Another question is choline something to consider for my child who's exposed to opioids? And I just found this to be really interesting. And honestly, I did not know the answer right away. And I did some digging. Choline is something that is starting to emerge as something that could be really important to protect brain development. One thing that I want to share with you all, if you're really into digging deep, which I know some of you are, this is what I did to look into choline. The latest and greatest research, you can search on NIH using NIH eReporter. And Lynette, I forgot about this link and I will share this link with you, but if you Google NIH and then eReporter, one word, you'll probably see it. And it's a really easy way to search for research that has been funded. But, as I said, research takes time. It takes multiple years to collect the sample size that you need to sort of test your hypotheses. So I looked up choline and prenatal substance exposure, and I found a grant on prenatal cannabis exposure, and they're using choline supplementation prenatally to see if that actually protects the developing baby's brain. And I was super excited about this. And then I also looked up NIH, and again, I love NIH. I love the scientists there. I was trained there as a growing scientist. And NIH also has, and I can share this link with you too, standards about how much choline exposure is appropriate, right? So I would probably go with those guidelines. It seems like it's something that couldn't hurt as long as you stay within those choline levels, and it may actually help. I don't know if giving choline to the child after birth would help protect the baby's brain or promote brain development. I don't know that, but I did see guidelines for choline for children, and I would say, probably wouldn't hurt to, and maybe these are already in vitamins that you might give kids. I'm not sure, but I would look into that. And if there's follow-up, and if you want to, if you're like, oh, wait, I want to say something else about that, please either put your comments in the chat or ask questions.
We did
Is that
Liz, we did get a kind of a follow-up on the fentanyl topic. Is it reasonable to say that what we do know about opioid exposure is likely to be mostly true about fentanyl exposure, since fentanyl is an opioid, but that more research is needed to get really specific about the long-term effects of fentanyl?
I would say that's accurate yes. I think that's a good sort of way of thinking about it. I think, with most, right, new substances, people get really nervous right away. They're like, oh my gosh, this is, a new thing that's here. We're all concerned, right? We're all thinking about how best to support babies, and we're all wanting, thinking about them. And so, I think there's generally two-ish camps, right, in the field, those that want to make sure that, like, we wait for the science and that we know that we're not, that we want to wait for the findings before we really get concerned about things, because we know that sometimes things can get blown out of proportion, and it can really harm moms, and it can really harm babies when they're stigmatized, and so we really need to be careful about, what the initial findings are. And then there's another camp that, really just wants to get these findings out there no matter what. And, and then eventually, right, the research will sort itself out. So I would say, but in general, as a community, even the people that are prone to not being as concerned about these things as others, even they, I would say, are, their ears perk up a little bit and they start to wonder, okay, what could be the effects of fentanyl? Because it is a really powerful drug, and a lot of what we know about prenatal substance exposure came from older studies from like the 90s, when maybe some of these drugs weren't as potent or as powerful. So I would just say, we're all sort of looking into it. We're all sort of wondering and are potentially concerned about it. Okay, and then another really great question was, are children more likely to have negative side effects to opioids if they need them for surgery? I looked into this as well. In general, it seems as though opioids are not recommended for surgeries for children, just in general, for any children, actually. There do seem to be other kinds of substances or, medications that kids can be given. I don't know if there's any literature out there showing that kids who have prenatal opioid exposure might be more susceptible to additional opioid exposure if they need it for surgery. And honestly, you all are also clearly so invested and are looking into the literature. And if you know something different, or if you've heard of some other study that I might have missed, like, please let me know. A great question. Is there any research on the father's substance abuse and how it may affect the sperm and conception? And yes, there is. So a lot of the research initially came from more around smoking, prenatal nicotine exposure, also marijuana, cannabis use from the father. Generally, what this research shows is that the sperm quality can degrade and there can be some DNA damage in the sperm, and that dad could be contributing to some of the effects of the substances as well. And really our research with dads in general is just not as up to date as with moms, unfortunately. And so we need to do more research here as well. What are the short and long-term health and behavioral considerations to be aware of before being open to adopting a newborn who'll be born with heroin in their system, if the mother uses frequently throughout their pregnancy? So, and this, I want to make sure that we also talk about, the strengths of these kids. I don't want to just talk about the negatives. And this is sort of why I left the behavioral things to the end as well, just to provide, a lot of hope and joy. And like, there's obviously tremendous joy to be had with raising kids, who, this could be, it's just another, like we're seeing with the brain findings, related to opioid exposure. I mean, this could be another sort of type of neurodevelopment. And with any kind of neurodevelopment, there's always strengths, as well as challenges. And so, I think about, I actually have a really good friend, who, one of my best friends, married someone who had been exposed to heroin as a child. And he's like the best guy I know. He's just like the most amazing person I know, and like so strong and resilient and just like so fun. And and they have two amazing boys, and they're wonderful. And so I think I was just sort of, as we're talking, I just want to remind ourselves of how phenomenal these kids are. That said, yeah, it can be really, really tough, better than I do, that some of these effects can make parenting really challenging. So one of the things that I think about in terms of short-term effects would be that neonatal abstinence syndrome, or neonatal opioid withdrawal syndrome. And that is, related to increased irritability and difficulty calming down, can be more crying, sleep. We'll get to the sleep as well. And so that can be incredibly stressful. And what I would say, if you're a mother of a child with opioid exposure, or if you're adoptive mother, please take care of yourself. Make sure that you have the support you need, because nobody should be parenting kids, on their own, isolated. Like, we all need like really strong support systems, friends, family. And we can talk about how to reach out to different support systems as well, but that's really important. I would be considering that. Every pregnant woman should be considering that, and adoptive parents, of course. So the short term would be sort of this neonatal abstinence syndrome, or neonatal opioid withdrawal syndrome. And I did look at the Generation O website, and they have fantastic resources available for considering what are some of the short-term sort of signs and symptoms that could emerge for kids. Not every child will develop NAS or NOWS. And there can be quite a range, and it's kind of confusing about like what is contributing to that range. We still don't really know. We know that making sure that the pregnant mom is supported in her pregnancy with opioid use disorder medications, making sure that she's going to her prenatal care appointments and, getting the support that she needs. That's really critical, and that can reduce risk for NAS or NOWS. But other than that, it's really hard to predict, which child might experience those symptoms. Longer term, I think, one thing that I've been thinking about a lot recently is that the research right now is showing that that does not seem to be a very strong signal of opioid exposure in early childhood when we're thinking about things like cognitive and motor development. One thing that I think about is that I don't really love our tools for measuring cognitive and motor development, because we are seeing a stronger signal later in development. So we are seeing things like risk for ADHD, anxiety, behavior challenges, regulation challenges. Not every child, of course, but for some kids. And so I'm sort of thinking that, maybe and maybe there aren't effects, right? But maybe also our tools are just not there to be able to best measure some of those effects. Because it seems like what I'm hearing from you all is that you are seeing these effects. So I'm, really concerned about measurement. And that's a whole nother discussion though. I'll pause right there. Are there any other follow-up questions to that or thoughts? All right, so there was another question about Duke. My son is part of Duke Health. We've been trying to get a diagnosis of what looks like seizures and paralysis. Have you experienced anything similar working with children exposed to opioids? And I would say, if you know your children best, and if your sort of flags are getting raised and you're concerned, like absolutely go to the doctor. Make sure you get some sort of an answer that you feel satisfied with. And if you don't, go to other people, like come to me, come to Lynette, we'll try to help you as well, because I think the worst that can happen is that you're worried about something, people are saying they don't see it, and then something shows up later and you're like, oh, if only I had like really followed up on that. And so I don't know the sort of the epilepsy literature as well, but I did Google this and looked at the literature. And there was one study that showed that up to 50% of kids with prenatal opioid exposure had seizures. And I didn't know that. And I was really surprised. And so this is not something that I have seen being talked about as much. Yes, Lynette, did you have a
Oh, I
follow-up?
just wanted, there's, two more comments have come in. One is from another Liz. My adoptive son, who is diagnosed with NAS, he's 2.5 years. Hold on, it just left me. Okay, he's 2.5 years old and he has a neuromuscular disorder. But there are times it seems like he still has withdrawal symptoms, even though we're told there shouldn't be.
I know. And this is what bothers me too, right? Is that I was talking about this with Lynette, is that, I mean, this is what you're seeing, and so it's true and real and valid. I mean, that's my belief, really. And because like I'm saying, you guys have this incredible expertise in your children. And so, you know, I've heard people say that. I've heard people say, oh, it's not withdrawal because it's been, you know, 30 days or what have you. But then there was a phenomenal OBGYN I worked with when I was at University of Utah who was saying like, no, I've had a lot of moms call me and say, you know, 3-4 months postpartum, oh, everything's fine. He just has a lot of colic. And it's like, well, is it like colic or is it more withdrawal? Like, I mean, and we need to, you know, be making sure that we're listening to this because you don't want to feel like you're going crazy. Nobody should be made to feel that way. What you're seeing is valid and important. And, you know, I would not, I mean, I can't say whether or not it is withdrawal, but it is something that's important to be, you know, looking into and considering.
Stacia, I'm not sure if that's how you say your name, but feel free to unmute yourself if you want to elaborate. But she's asking about polysubstance use, particularly connected to prenatal alcohol exposure and diagnoses. Can you talk on that? Or
So
you can
yeah,
add to it.
I can elaborate. It's Stacia. And I guess my thoughts, so I have two children who are diagnosed with FASD. But there was also, we know, documented drug use for one of them. And I'm just curious about how the research is going and looking at those things across, right? Because right now my kids can get a diagnosis of fetal alcohol, well, under the umbrella of fetal alcohol spectrum disorder, but there is no diagnosis for necessarily, especially for getting um, identified in schools under special ed through other health impairments, right? And so, is there, and it seems like the symptoms are so similar, and it's like, I'm not sure that I can, you know, pinpoint that this behavior my daughter is exhibiting is from the heroin or it's from the alcohol. And usually when there's drug use, there's also alcohol use. So I'm just kind of curious about what's happening in the research world around pulling those together under a diagnosis, or just in order to be able to get children's supports, because it's very hard to document alcohol use. You can't test for it at birth, but rates are like something like 1 in 20 kids could be diagnosed with it, right? And so how are we kind of pulling those, looking at the pieces, but also pulling it together to make sure that they qualify for services and supports?
Yeah, that's a great question. And I mean, when we talk about things like prenatal opioid exposure, we're really considerate polysubstance exposure because that's, I mean, it is alcohol, it's, you know, a lot of times smoking and other substances. And um, so it's really difficult to tease apart the effects of one versus the other. I mean, they try to do that in like mouse studies, right? They can do that and they can be really precise, but it's also not really like the real world. And so, um, to me, I think it's just important to get support in any way that you can, like early intervention support. So if that means, you know, you get it through like a fetal alcohol syndrome diagnosis, great. If you get it through like a NAS or NOWS diagnosis, great. You know, like just basically it's like whatever diagnosis you need to get to in order to get those supports, I think is important. And there aren't enough early intervention services out there. I mean, I'm sure you all know better than I do that like when you finally do get referred and can, you know, do get, you know, accepted into these early intervention programs, their waiting lists are really long and they're getting cut in a lot of places and it's really concerning. And as someone that cares a lot about early childhood and attachment, it's really frustrates me because I mean, we know how powerful the first 3 years of life are for the child's brain development and how repairing it can be to have this incredibly strong connection with your caregiver, with your parent, mom, dad, and it can be incredibly healing. And when you don't get those supports, it's just more stress and it's just really gets to be really difficult. um, so So I'll move on to medication. What can I share with families about possibly needing medication to help with sleep, ADHD, anxiety, etc.? Many families feel it's taboo for a young child to need medication to help with severe symptoms, even if a doctor has prescribed it and thinks it will be helpful. And yeah, this can be really tough. It's hard. It seems to, this question to me would, if I knew the individual case, I think I could better answer it, just because it's so individualized, right? Like, what family is open to medication. I would say if you were a family, or if you're working with a family that is not, very comfortable with medication, there are lots of behavioral things that you can do, which I'll talk about soon. If the family thinks the child is too young or doesn't need it or what have you, there's a really good article about this in the Child Mind Institute, this really wonderful website that I sent the link to Lynette. But it basically, what they say is, think about this person who doesn't think that the child needs medication. How close are they in the child's life? If they're not that close, then maybe just ignore them. If they are really close, what they're basically are saying is, like, sort of blame the doctor. And, if you feel like the child would best benefit from the medication, you can say, well, this is what, this medical community is telling me. And it's also doesn't have to be a lifelong thing. I've worked with a lot of young kids who are in foster care, right, most of whom have had prenatal substance exposure. And it can be tremendously helpful for kids to be able to calm down and regulate enough, so that they can be successful in the classroom. They can be, if they're in foster care, they can be successful with in their foster home. If they're with their families and their families are getting really stressed out. I mean, that's one of the worst things that we can have for children, right? Our parents that don't have the resources and the energy levels to manage kids. That's why at the beginning of this, I was like, we need to take care of ourselves. And that's so critical. So if the person who submitted this question just wants to follow up with me, I'd be happy to follow up with them as well. In terms of which medications are safest for kids with ADHD, I would talk to your psychiatrist about that, because I'm honestly not up to date on the latest literature there. There was someone who wanted to find a practitioner in Phoenix, Arizona, who understands the kids. And it can be really, really hard, right? When you're going to a pediatrician or even a psychologist who doesn't have expertise in prenatal substance exposure, they may not, you're probably more of an expert on the literature and the research and the best things for the kids than they are. And so one thing that I did was I found a really great home. I think it was called Jacob's Home in Phoenix, Arizona. It was to support kids with prenatal substance exposure. And I just messaged them and I said, hey, do you have any pediatricians you would recommend in Phoenix area? I would do things like that, like go to where there's like a really great trusted source. Maybe they're not a pediatric clinic, but they know kids with prenatal opioid exposure. And then I would ask them for specific recommendations in your area. There's a really great question about how exposure can impact sleep and circadian rhythms. And so we need more research on this as well, but the research thus far shows that kids with prenatal opioid exposure, they have more time awake, less time asleep, and they spend more time in active sleep, which is like REM sleep, rapid eye movement sleep, which is when you're dreaming. And this kind of sleep is really important for brain development and for memory consolidation. And I just found this really fascinating because I was thinking, wow, maybe this is a way for the brain to also be repairing itself for these kids because the REM sleep is so important. However, then they spend less time in quiet or more restorative sleep. And this is like the type of sleep where like, you could like move the child and the child's just not going to wake up. And of course, like that then makes it so much harder on the parent or caregiver because you're having to tiptoe around the house, any slight movement or any slight noise could wake the child. And then you're like, oh no, he just fell asleep and I just wanted 10 minutes to myself. And so this all, which speaks to the importance of making sure that you have that support system that you need because you're not, there's nothing wrong with how you're parenting or how you're helping your child sleep. Like some of these children just have a harder time getting that deep sleep. And I'm going to move on to the behavioral questions now, unless there are other follow-up questions.
We do have a lot of questions, but I think you should go through the ones you have initially, and then we'll see what we have time for in the end.
Okay. Great. So there was my 5-year-old gets into so many social scrapes despite being on guanfacine. He's so reactive and emotional. We have multiple therapeutic supports. What else can I do to help him grow up into a healthy and peaceful adult? And I just love this question so much and thinking about the importance of having, health and peace in your life. And so one thing, so again, I'm a psychologist, so I know a lot about behavioral therapies and supports. My favorite therapy of all time, and this is for all children, and I think and I know it also works for children with prenatal opioid exposure. It's called parent-child interaction therapy, PCIT. And Lynette, I need to send this to you too as another resource because they do have like a really great website and ways on the website, there are ways to find a PCIT trained therapist in your area. And I believe they're trying to, use this therapy via telehealth so that people can, benefit from it, even if they're not in a place where there's a PCIT provider. This is something that I use parts of this all the time. I used it with my kids. Basically, that's 2 phases. The first phase is all about, and the goal for the PCIT is to help with regulation, is to help with attention and behavior regulation and calming children down. And the first phase is all super positive, and it's all about spending really positive, giving your children positive attention, and having what's called special playtime with your child, which is you just have to do it 5 minutes a day for it to work. And I know like in our minds, it's like, oh, 5 minutes, I can do anything for 5 minutes. But of course, then you know how hard it is then to integrate 5 minutes into your daily life. But if you you would talk to your therapist about how you could do that. And so the effects are incredibly strong, and this is a really, really helpful intervention. And so the first phase of it is, learning how best to spend that positive time with your child. And then the second phase is then, what to do when your child, has emotion regulation struggles and tantrums and isn't listening to you. And it's all about how to have, sort of positive discipline approaches to supporting your child. But from the research, a lot of the research shows that like kids' behavior issues just plummet after the first phase, just the positive phase, and you don't even need to move on to the it's basically how to support kids and giving them timeouts, which I know some parents don't like timeouts, and this is they work with the parent and how to be effective around that. But a lot of kids don't even need to go to that second phase because they just do so well with that positive attention. So how do providers evaluate ADHD versus brain damage from drug exposure? Do they need different treatment? Should opioid medication be avoided if possible for medical needs given in utero exposure and family history of dependency? And what interventions are recommended to babies and toddlers? So this is so great. So it's the neurological effects of prenatal opioid exposure are, I mean, we're really just finding out what those are, right? I mean, with I know Lynette you had posted about the really important OBO study on your website, right? Showing that kids with prenatal opioid exposure have lower brain volumes, and some have lower amygdala volumes. The amygdala is the area of the brain that is involved in emotion, and how that then directly relates to behavior for these kids. They're following up on that. That's going to be really important. But I don't even know if you went to your doctor and said, I want my child to have an MRI, I don't even know if they would be able to pick up on things at the individual level. So what I would say is really, at this point, you should be focusing on the behavior, and how best can you support the child's behavior. You know, I don't know why. I mean, if opioid medication for, I'm wondering if the doctor recommended opioid medication for pain, or why it would be recommended. But I would say, in general, opioid medication should be avoided if it can, just because there's just high potential for addiction. And then what are the recommendations for babies and toddlers? So that parent-child interaction therapy, I believe they started at 18 months. It might be 12 months. So that would be a really good intervention. There's also the Incredible Years intervention. That's also a great one, sort of similar principles around giving your child a lot of positive attention. And then there's attachment and biobehavioral catch-up, which is also like a parent-infant supportive intervention. It's just now being tested for parents and children with prenatal opioid exposure. And to be honest, a lot of these treatments can be really hard to find in the general community. And it's so if you are interested in one of those and you're having a hard time finding a provider, definitely reach out to me and I can help. Next question is, I work with children 0 to 5 in early intervention. It's awesome. Families ask me how to help their child prepare for elementary school and what they can share with the school to help them understand that the child's brain is different due to substance exposure in utero. What could I share with them to help them advocate for their child? And I saw Generation O has a great resource there, which I loved. And I looked at that. They have a really great pamphlet that sort of breaks down what the teacher, might want to be considering, or what the school might want to be considering. There are IEPs and 504 plans as well. So there's, additional testing that kids can get in order to get accommodations in school if they need it. Do you find that increased biting, even sometimes aggressive, is common among kids born exposed? And I would say, there's sometimes increased risk for these emotion regulation challenges, which means, more of the biting and stuff. I'd be curious about the age of the child here. So for like toddlers or preschoolers who might bite, there are things that you can do. Well, first of all, I'd want to know, are there certain times where the child seems to be, more at risk for the biting, or sort of the more anger, the more emotion regulation difficulties. And then if you find that, it's like always in the afternoon right before the nap, he's, pretty tired and wiped out and just, doesn't have the words yet to express how he feels or what he wants, then you might want to just spend, that time monitoring him really carefully, because he might be more at risk for like showing those challenges. If it just sort of seems to happen randomly, I would also be curious about like, what is the function of the behavior for him? Is it because he wants a lot of times kids, they act out because they want attention, even if it's negative attention, like they just want the attention. And so is that what's going on? In which case, that parent-child interaction therapy is really great for helping parents give their kids that more positive attention. There's another really great website, 0 to 3, that has so many wonderful recommendations for how to support young kids. And it's their emphasis is on that birth to 3 age, and all the challenges and wonderful things that can also show up for young kids, but they also help parents with sort of the common challenges that can occur for young children age 0 to 3. What tools do you suggest for kiddos that can have issues with their emotions? That also depends on the age, and there are a lot of really great recommendations out there. For older children, and really you can start this with preschoolers as well. There are usually the first thing we would do in therapy is just teach children about emotions and feelings and what they are, because if you don't really know what you're experiencing, it's hard to manage that. So that's sort of that emotion identification, emotion recognition is really important. There's like feelings thermometers, feelings wheels. Again, 0 to 3 will have great resources about this as well. And then once you can identify or manage, can recognize the feeling that you're having, then you can learn skills to cope with it. One thing that I did actually with my kids, my younger one is just a little bit more sensitive, and and so he also is very sweet, but also just a little bit more prone to like anxiety and frustration. We went and got a calming box for him, and he loved it. And I went and I got it for my older child as well. And it's just this cute little box. We went, and you can get it at, Walmart, Target, wherever. And we put in things that help soothe 5 senses. So something that smelled nice, something that looked really nice, something he liked listening to, something that felt really nice, and then something that tasted good. And of course, like young kids, they're very excited to pick candy. But it's fine. And so they picked like Taylor Swift. They liked listening to Taylor Swift, of course, and they had got like a fuzzy blanket that they could, touch. And so that just helps with sort of also grounding children, and and it distracts them too. So I would say, for the person that asked that question, can also follow up if there's some more specific concern you have about your child. And then what resources are there for parents that are best to read or ensure that we're learning and understanding our child the best that we can? Amazing question. As far as I know, there is not a sort of general book out there for parents that have children with prenatal substance exposure, which is really unfortunate. The Generation O website has a lot of really amazing resources. And I would also say the 2 websites that I recommend, 0 to 3 and the Child Mind Institute, also has really great resources. There's another, there's the Center for Parenting and Opioids, which is part of the University of Oregon. And they also have some good resources on their website. I sent Lynette that web address. And then there is some sort of miscellaneous questions as well. So what considerations should be made regarding vaccinations of opioid-exposed babies, especially regarding the exposure some vaccines give babies to aluminum and mercury. And I wasn't sure about this answer either, so I just looked it up, and it's recommended that kids with opioid exposure still get the, normal CDC recommended vaccines. It looked like many of these vaccines don't have aluminum or mercury anymore. But of course, you could talk to your pediatrician about that if you have any questions. And then there are some really important questions about methamphetamine exposure. This is another one that's popping up recently, especially out west. There have been a few studies, but really nothing very comprehensive or strong. And really what I would be concerned about are similar things to be looking out for as one would look out for the kids with opioid exposure. So as far as I know, there's not a known withdrawal syndrome that's associated with methamphetamine exposure. That doesn't mean that there doesn't exist, just means that we have not clearly identified one. And I would also be thinking about things like regulation, irritability in young kids, as well as some behavior challenges.
Liz, can I interrupt with a question?
Yes.
And I realize we're getting close to the end of our time together, but this one comes up a lot in our support group. At what age is it developmentally appropriate to tell your child that they were exposed to drugs in the womb so that they can better understand their struggles?
Yeah, that is a really, really good one. And yeah, I mean, this is one I'm going to ruminate about even after. So I will give you my answer, but I've never been asked this question, and it's so good. So we definitely, you don't want to no one wants to pathologize the child or, any parents, right? Or make them feel like there's something wrong with them, right? I mean, I think about this, that what initially comes to mind is like, for a child with autism, like how do you sort of also explain that, not saying that children with opioid exposure have autism, but, it's a similar sort of condition. But you want to, think about it in a way that is strengths-based and can empower them. And also, I mean, I also think it could help, right, for a child to make sense of what might be going on if they're feeling different in any way. You want to validate that too, and just say, well, listen, this is what, we know happened, and we're not really sure what exactly that means, but maybe this is, a reason why you get frustrated really easily, or maybe a reason why you're having trouble paying attention. And then I mean, and this is something that I feel like I could do a better job of too, is just thinking about like, are there good role models out there for kids that have had, some of that exposure, and what are they doing now, and how are they thriving? As I mentioned, my friend's husband, who's, just this really awesome guy, and is just has a lot of energy and uses that to help support kids. And he was a teacher, and now he's helping with reading. And, there are a lot of like really, a lot of CEOs have ADHD, honestly. We know like, and so it can be a real strength, right, in the right environment. So I would think about how to empower the child, and to say, yes, this happened, and this is how we can like kick butt despite this. I see some comments of people that might have talked to their kids about this. Did anything go well when you did? Were there anything about the conversation that like you thought was like a really good angle?
It looks like I see one mom here said that she told her son when he was about 11 or 12, just basic info. He's 15 now and he has a good understanding and says it helps him make sense of things about him. My son is also 15 and I think I mentioned it to him a little bit younger. But it's really interesting because I know this mom and I know her son. I know what she's told me about her son, and they're very different personalities. So my son, he doesn't really care. You know, whenever I try and bring it up, like, you know, this is why you're struggling. It's not your fault. You know, I'm bringing it up so that I don't want him to feel bad about himself. But doesn't want to talk about it, says that he doesn't care. Whereas I believe this other mom is able to sit down and have, you know, real great conversations with her son and back and forth. And so, you know, just like the exposure is going to affect every child differently, so is this information. So I think for a lot of people, you just kind of have to feel it out, you know, and what's best. But someone did say, and I know a lot of us are adoptive and foster moms, and we're always told that honesty is the best policy. And someone just recommends that, you know, tell them what they need to know early, age appropriate truths and early conversations. So.
Yeah. And then when I what my training was also just, you know, for example, kids have questions about, you know, where do babies come from or whatever, like you give them the answer, like just enough. And then if they want more, you know, information, if they have more questions, then they can follow up. But I would probably take a similar approach to the substance exposure. If they're like, what does that mean? And what is an opioid, that, you know, then you of course engage in that. But if they're not interested or don't seem to mind, then, you know, then you don't push it, and, you know, maybe it'll come up again later.
Is there any last message that you want to leave us with, Liz? I don't want to take up too much more of your time as we get close to the hour.
Yeah, so it just, one thing was that someone said it makes, you know, it seems like it's hard to make direct conclusions. There's a landmark study underway, but what do you think is needed to make this leap? And so I would just say, like, the research, like we just need more research, and we need better data, and we need, you know, to hear from you all, and we need to hear your voices and your perspectives. They're so critical, and you know, so grateful to have been able to spend this time talking with you all, and I hope it was valuable, and I hope to get feedback from Lynette as well about you know, whether this was helpful, or if we could have done something different. But thank you all.
Wonderful. Thank you. Yeah, if anyone wants to give feedback in the posts that were where you saw the information about tonight's event, you can give feedback there and then I can pass it on. You will be receiving an email tomorrow with the links that Dr. Conrad had mentioned. I made notes of the ones that we didn't talk about before. So you're going to get a lot of links, a lot of things to look into. And I just really want to thank you all for being here. Like I said in the beginning, this is our first monthly event. We're going to be running events like this on the first of every month. So it'll change what day of the week it is. Next month, we have a speaker who is an adult who had NAS at birth. We should get your friend's husband to come on sometime too. But this particular woman, she's a passionate advocate and a powerful voice for our children. She's spoken on the topic quite a bit in the past. And we will be opening registration within the next couple of days for next month's event. So look, same place you found this one. And thank you again, Dr. Conrad. We are super appreciative of your time and your information. And yeah, thanks to everyone. Everyone have a good night, good rest of their evening. Bye.
Bye.